Going to see about the gluteal region in this video. So this gluteal region is mainly used for the intramuscular injections. Okay, so which is main clinical importance of this particular region. And coming to the boundaries of it, superiorly we have iliac crest, inferiorly we have gluteal fold, laterally we have the imaginary line with joining the anterior superior iliac spine. So ASIS is the anterior superior iliac spine to the front of the greater trochanter of the femur bone. This trochanter is presented in the femur bone. So the imaginary line with joining the anterior superior iliac spine to the greater trochanter. Medially we have natal cleft. Okay, these are the boundaries of the gluteal region. Whereas what are the structures will be presented in the gluteal region? We have bones and joints, ligaments, muscles, vessels in the sense arteries, nerves, and bursa. So all these will be presented. So thickest muscle is referred as the gluteal maximus. Coming to the muscles, we will discuss about it. Coming to the nerves, thickest nerve is the sciatic nerve. We will also discuss about it. Okay. So coming to the bones and joints, what are the bones will be presented mainly in the gluteal region is the cochleus, gluteal surface of ilium, ischium, upper end of the femur bone because it's going to articulate with the acetabulum. Okay, so posterior aspect of the hip joint and sacroiliac and sacrococcygeal and sacroiliac joint. So these are presented in that particular gluteal region. So coming to the, so here you can see the hip bone. So this is the acetabulum. So here the head of the femur is going to articulate. So this is the iliac fossa. Here we have gluteal lines. So as I said, the head of the femur is going to attach with the acetabulum and forms the hip joint. So coming to the ligaments, we have majorly two ligaments, that is sacrotuberous ligament and sacrospinous ligament. Okay, these are the major two ligaments which is presented in the gluteal region. So coming to the sacrotuberous ligament, so this is actually attached from the ischial tuberosity to the superior iliac spine, that is posterior superior iliac spine. This is the attachment of the ligament. So ischial tuberosity to the superior iliac spine, that is dorsal surface of the sacrum. As the name suggests, sacrotuberosity ligament, right? See, sacrotuberous ligament. Sacro which indicates the sacrum, tuberous which indicates the posterior superior iliac spine. Okay, so the attachment is easy, that is from the ischial tuberosity to the posterior superior iliac spine, that is dorsal surface of the sacrum. Tuberosity, tuberous in the sense tuberosity, ischial tuberosity to the dorsal surface of the sacrum. Coming to the sacrospinous ligament, here the attachment is from the ischial spine to the sacrooccipital junction. Okay, so spine in the sense ischial spine, sacrum in the sense this junction refers to the junction. Okay, so these are the attachment. So these two ligaments, okay, these two ligaments is going to convert the two notches which is presented in that particular hip bone, that region, in that region. So these two notches are converted into foramen by these two ligaments. Okay, so here you can able to see, actually these are the foramens which is formed by the ligament. Notches is converted into the foramen by these two ligaments. Okay. So the two foramens are greater sciatic foramen and lesser sciatic foramen. Okay. So these two foramen have contents in it. The structures will be passing through these foramens. We'll be seeing that structures too. Okay. So according to the cutaneous nerve innervation, we will be seeing about it. So before that, we'll be seeing the okay. This cutaneous innervation is normally presented in the superficial fascia of the gluteal region. So we have four quadrants. This gluteal region is divided into four quadrants. That is upper medial quadrant, upper lateral quadrant, lower lateral quadrant, and lower medial quadrant. Coming to the upper medial quadrant, we have all these nerves which are arising from the posterior rami of these nerves L1, L2, L3, and S1 and S2 and S3. Upper medial quadrant. Coming to the upper lateral quadrant, we have iliogastric and T12 nerves. Okay, upper lateral quadrant, lateral branches of the iliohypogastric nerve and T12 nerve. Coming to the lower lateral quadrant, we have lateral cutaneous nerve of thigh, that is L2 and L3. Coming to the lower medial quadrant, we have the posterior cutaneous nerve of thigh and perforating cutaneous nerve, that is T2, S2, S3. These all are presented in the superficial fascia. Okay, so these are the four quadrants and the nerves arises or supplied or presented in that particular quadrant. Okay, so coming to the deep fascia of the region, it is deep fascia is below continued with the deep fascia of the thigh. Deep fascia of the thigh is referred as the fascia lata. Okay, so this in the gluteal region, this deep fascia is splits into two and encloses the gluteus maximus muscle first, okay, and gluteal minimus muscle. These are all about the fascia, deep fascia. Coming to the muscles of the gluteal region, we have 10 muscles, that is gluteus maximus, gluteus medius, gluteus minimus, tensor fascia lata, piriformis, superior and inferior gemellus, obturator internus and externus, and quadris femoris. All these are the 10 muscles of the gluteal region. Maximus muscle, it's get originated from the dorsal segment of the ilium and posterior gluteal line, side of the side of the cochleus and sacrotuberous ligament and dorsal surface of the sacrum. So it gets originated from all these areas. So dorsal segment of the ilium, dorsal segment of the sacrum, sacrotuberous ligament, and posterior gluteal line. Okay, these are the originated from side of the gluteus maximus. Coming to the insertion, it gets inserted into the gluteal tuberosity and iliotibial tract. Okay, so these are the insertion of the gluteus maximus muscle. Coming to the nerve supply, it is supplied by the inferior gluteal nerve, which arises from the L5, S1 and S2. Okay, actually coming to the actions, we have the, it is the powerful extensor of the hip joint. Okay, so it is the main function of it, and lateral rotation of thigh, and it abducts the thigh. Okay, so acts with the tensor fascia and it stabilizes the pelvis and extend the knee. Okay, so main action is to main extensor of the hip joint and lateral rotation of the thigh. These are the two main functions of the gluteus maximus muscle. So it is supplied by the inferior gluteal nerve, by the L5, S1 and S2 nerve. Okay, to the gluteus medius muscle, that is arises from the gluteal surface of the ilium. Gluteal surface of the ilium and get inserted into the greater trochanter. Okay, as been saw, uh, gluteus medius muscle originated from the gluteal surface of the ilium, whereas inserted into the greater trochanter. So these origin and insertion are somewhat important. Just know about it. Where it arises, just any one side where it gets inserted. Okay, so gluteus maximus muscle just originated from the dorsal surface of the ilium sacrum. That is the main thing, and arises from the sacrotubular ligament and cochleus bone. Okay, all those things. So likewise, gluteus medius that arises from the gluteal surface of the ilium, it inserted into the greater trochanter. Okay, coming to the gluteus minimus, just arises from the gluteal surface of ilium, inserted into the greater trochanter as such. Okay, coming to the nerve supply, both these nerves, medius and minimus, supplied by the superior gluteal nerve, which arises the L4, L5 and S1. Okay, coming to the actions, it both these muscles will have similar insertion, origin and nerve supply, all those things, gluteus medius and gluteus medius, minimus and medius. Okay, so it abducts the thigh, and it is medial rotation. It is the main function of it, medial rotation. Okay, medial rotation of thigh. So coming, so these are the three major muscles what we have seen now: gluteus maximus, gluteus medius, gluteus minimus. Okay, these are the three muscles. So here you can see the gluteus medius muscle, gluteus maximus muscle. Okay, coming to the other muscles, what we saw: piriformis, superior calamus, superior and inferior, obturata interna and externa, and quadratus femoris. Okay, so coming to the piriformis, it is the key muscle of the gluteal region. So piriformis is the key muscle of the gluteal region. So coming to the origin of the piriformis, just arises from the middle three pieces of the sacrum. Just arises from the sacrum, piriformis, and gets inserted into the apex of the greater trochanter. Okay, so we have to know why this piriformis is a key muscle of the gluteal region, because some structures passes above it and some below to it. Okay, so as we know, we have two foramen, that is greater sciatic foramen, lesser sciatic foramen. In the greater sciatic foramen, this piriformis just gets passed through it, and some structures just pass above it, some structures below it. Okay, that we will be seeing about it. So coming to the obturator externus, we just originated from the outer surface of the obturator membrane. Okay, and some margin of the obturator foramen, and get inserted into the trochanteric fossa, that is just nearer to the greater trochanter. Okay, coming to the obturator internus, just it gets originated from the same obturator membrane, and get inserted to the medial surface of the greater trochanter. So majorly all the muscles will be inserted into the greater trochanter. Okay, but whereas the obturator externus will be inserted into the foramen of it. just fossa. Okay. Coming to the superior gemellus and inferior gemellus muscle. Coming to the origin of the superior gemellus muscle. So it gets arises from the upper part of the sciatic notch. So as we know, the two ligaments is going to convert the sciatic notch into the sciatic foramen. As well, the sciatic notch which is presented at the upper part of it gives origin to this muscle. Coming to the insertion, it is inserted into the greater trochanter. Mostly all this gluteal region, as I said, it's going to inserted into the greater trochanter of the femur bone. Okay. So coming to the inferior gemellus, it origin from the lesser sciatic notch. That is greater upper part of the sciatic notch. Inferior gemellus is from the lesser sciatic notch. It gets inserted into the tendon of the obturator internus. Okay, in the tendon of it, it's going to blend with it, going to insert it. Okay. So coming to the quadratus femoris muscle, it gets originated from the ischial tuberosity, and it gets inserted into the quadrate tubercle. Okay. Coming to the nerve supply, the piriformis is supplied by the S1 and S2, ventral rami of the S1 and S2. Obturator externus from the obturator nerve, obturator internus from the obturator nerve to obturator intestinal nerve, that is L5, S1 and S2. Then superior camellus, that just supplies by the nerve to obturator internus. Inferior, that is nerve to quadratus femoris. Quadratus femoris, nerve to quadratus femoris. So here the two muscles, that is gemellus muscle is going to differ in the nerve supply. That is gemellus superior is from the obturator internus, inferior is from the nerve to quadratus femoris. Otherwise, the other muscle supplies are so easy. It's just related to its name. So obturator internus, nerve to obturator internus. Superior is these two are same nerve supply. Okay, like that. Just remember of it. So coming to the actions of the short muscles in this fibriformis, superior, inferior gemellus, obturator internus and externus, all are the lateral rotators of the thigh. Okay, it is lateral rotators of the thigh. That is the main function of it. Coming to the applied aspect, we are going to see the Tendelberg sign. Okay, which is a main important clinical significance. Okay, this is the Tendelberg sign. A patient is used to stand. Okay, when there is paralysis of gluteus medius muscle and minimus muscle, there will be dislocation of the hip will be taking place. Actually, the positive, when this Tendelberg sign is positive, when there is paralysis, when there is dislocation of the hip, and when there is a fracture in the neck of the femur, all these will indicate the positive sign of the Tendelberg sign, positive indications of the Tendelberg sign. Okay, so can able to see here, this is the Tendelberg sign positive. So when this is the affected side, this is the normal side. Okay, so when the person is set to stand, okay, this is the hip joint. This hip joint is going to it's going to imbalance. Okay, so the person cannot stand properly. They will be they'll be in this position. You can able to see here, they'll not stand in a erect manner, in a correct manner. This is referred as the Tendelberg sign. See here, we have two gait, lurching gait. This Tendelberg sign positive when there is dislocation of hip joint, as there is paralysis of the gluteus medius and medius muscle. So lurching gait can be seen in this particular person. Okay. So these are all about the gluteal region. Thank you.